Welcome to this edition of the First Aid Show. With a catastrophic bleed, you need to act fast to stop the bleed. In this film, we asked a paramedic about treating catastrophic bleeding.
So, in modern society, knife crime and sharp implements causing injury are becoming more and more common. Sometimes you will find somebody, a casualty that is bleeding. You will not necessarily know where the implement is that's caused the injury, so you don't know how deep that wound is, how far it's penetrated. The most important thing you can do is look at the type of blood loss that they have. If it's just oozing out slowly, we would ask that you get anything to hand, a t-shirt, a towel, any item of fabric, apply it onto the wound and apply strong pressure. You can even ask the person to apply pressure to their own wound. If the injury is spurting out and it's likely that this injury has affected an artery, then it's really, really important that you get help very quickly. We would ask you to apply pressure to the site of the wound, but also you can use a belt or some sort of tourniquet to restrict the blood flow above the injury site. If it's on a limb, tie it really tight until the blood stops spurting out, and again apply pressure. The other thing you can do is lay the patient down flat and you can elevate the limb above their heart if it's legs or arms. If the wound has happened anywhere near their neck, their face, their heart, the top part of their chest, absolutely call 999, apply pressure if you can. If there's a hole, you can insert your finger or a fist to try and stop the bleeding. It's highly likely if you report this sort of injury and casualty, the police will be on scene very, very quickly, and we very commonly use the police to help stem blood loss while we treat the patient. But yeah, it's a time-critical emergency. Keep the patient still and apply pressure to that wound. The first thing you should do if there is really significant blood loss is try and stop the blood loss. There's no point moving on, if they've stopped breathing, there's no point moving on to chest compressions if they're bleeding out, because all you'll do is pump the blood out of their body and that will be unsurvivable. So stop the bleeding. That's a really critical and important step.